Hi, everybody. Welcome to the Healthspan podcast. We are excited that you're here. We're going to talk again about subjects related to a comprehensive and connected care to helping people live a long and vital life. I'm your host, Dr. Robert Todd Hurst. I'm a cardiologist. I'd like to say the most important word would be preventive cardiologist, although we've kind of struggled with that word, haven't we, Riley? Like,
Yeah,
what's your take? Do we like preventive? Do we like integrative? What do you think?
I think preventive. It's
Yeah,
strong, it's what you wanted to be in the beginning. It's like kind of, or where, what you were when we first started doing this. And we toyed with all those other words like holistic, integrative, and nothing's seemed to fit quite as well. But it's funny going back, I look at some of our old content and we've played around with different words.
yeah,
Some of the stuff we've come up with is pretty creative.
Well, it's kind of ties into our subject today, which is stroke. And one of the complexities I think in medicine in general, and particularly when we talk about stroke, is how many different phrases or words are used or can be used. It just amplifies the complexity. I mean, biology by itself is complex. Although I'll never take anything away from the complexity of, say, astrophysics or quantum theory or whatever. Those are incredibly complex topics, as are most sciences. In the details, biology is a little bit special in the variation of it, the variation of person to person or subject to subject, all the different variables that can affect an outcome. It just makes biology incredibly complex. Or if you're more of a science, like a math science person, you might say it just makes it messy. I don't know. I kind of enjoy that. But adding to that complexity is how many phrases we use for things. We just talked about, what's the right phrase? Is it preventive? Is it integrative? Is it holistic? All of those have different connotations for people. Even though the definition might really fit, they trigger different thoughts for some. And in medicine, preventive would be the right phase. But what we talk about most of our time is metabolic syndrome. But I think that is a complex topic as well, because I was just thinking about all the different ways that you can describe metabolic syndrome. It's been called Syndrome X in the past, cardiometabolic disease, metabolic syndrome, insulin resistance, glucose intolerance, carbohydrate intolerance, pre-diabetes. I mean, the list just goes on and on, and it just adds to the difficulty in explaining things. And the same thing with stroke. I think a lot of people have different ideas about what a stroke is. And, part of our goal today is, to describe, get people understanding what is a stroke, but way more importantly, how do we prevent this? And I think this is incredibly important because, recent studies, in fact, it was the World Health Organization came out in the last couple of years and said stroke rates are predicted to increase 70% in the coming decade. 70%. That's just stunning, especially for something that is probably mostly preventive. And so I guess, Rylan, your thoughts on that, like the whole idea that stroke is increasing when we have so much information on how to prevent that. Is that as big a surprise to you as it was to me?
Yeah, I mean, 70 is a big number. I mean, 50 would be a big number. And I think we see statistics so much. I know I do this when I see stuff like that, and sometimes you kind of gloss over it. But when you really sit and think about that, 70%, that's a big number. Despite knowing so much about this, and I see that goes to show that information is not everything. Like everyone has proof that, it's, you got to do this, this, and this. But what you need is the right guidance to be able to actually implement that into your life. We live in a world full of information on how to prevent things, but how to actually do those things and implement them into your life is another. And so that is what, we're here to do. That is the future of healthcare.
Yeah, absolutely. I heard one of my favorite podcasters called what we're doing Medicine 3.0, and it said what he described was, Medicine 1.0 was back in the pre-science days where people would get leeches and holes drilled in their head to release the bad humors and things, and then Medicine 2.0 was science-based, and the real successes that we've had in developing antibiotics and more recently antivirals and therapies based on science that have been really effective in helping save people's lives. But now we're up against a completely different problem. Like, while we're still really good, in fact, incredibly good at treating acute illness, what we are really bad at, like strikingly bad at, is helping people stay well. Get well, stay well, live long and vital lives. And he described that as Medicine 3.0. And I love that, because I'm like, okay, this is the future of healthcare, and I'm excited to be a part of that. And along the lines of stroke, which you were talking about earlier, I think is really relevant. It can be a little bit deceiving when we talk about research findings and we talk about relative risk versus absolute risk. And, we should talk about this in more detail at some point. But, what people miss sometimes in this is they'll say, oh, well, that drug has a 25% decrease in heart attacks, for example. But what they are really talking about is a relative risk decrease, which might mean that the decrease went from a 1% risk to a 0.75% risk. So the absolute risk reduction is only 0.25%, but we're calling it a 25% relative risk reduction. So in that case, when the numbers are small, those relative risk numbers can be deceiving. But when we come to stroke, and stroke is the things that people are most afraid of in the future. I think stroke is certainly near, if not at the top of that list. I think anybody who's had a loved one or experienced somebody who's had a debilitating stroke, it's probably top of their list. Like, that is just such a devastating complication or health complication, because it's worse than death. It can leave you in a position where you can't take care of yourself. You can't communicate. You can't do the things that make life enjoyable, and yet you're not dead. You're still alive. And so I think that is a frightening thing for a lot of people. And when you talk about a 70% increase, and then realize that 70% increase on a very big number to start, about 800,000 strokes a year in the United States alone. 800,000. That's somewhere around one every 40 seconds in the United States. And you think about a 70% increase in that in the future, those are frightening numbers.
Absolutely. Well said.
Yeah, so first of all, let's talk. Let's get back to one of the things that we discussed in the beginning is the definitions, the nomenclature of stroke. And so, stroke is the most common phrase that we use. The medical term is a cerebral vascular accident, or CVA. And what that means is a death of brain cells due to lack of oxygen. So, stroke is a really common problem, as we've talked about. It's the third leading cause of death, the number one cause of disability. And there's, in broad terms, two different types of strokes. There's one that's where there's a lack of blood flow to the brain. That could be from a blood clot or a blood vessel closing. That's called an ischemic stroke, and that's most strokes, about 85% of all strokes. But also bleeding in the brain is a different problem, but still called strokes. That's called a hemorrhagic stroke, and that's about 15% of strokes. Just adding to the complexity of this, doctors refer to cardiovascular disease. And so some people might say, well, wait, why is a cardiologist talking about stroke? I mean, he's a heart doctor and this is a brain problem. Well, cardiovascular disease is a phrase that we use in medicine to describe the combination of heart attacks and strokes. And that's because there's so much overlap in the risk factors. For a lot of, for the predominant risk factors, the same things that lead to an increased risk for heart attacks also lead to an increased risk of stroke. And so when doctors talk about cardiovascular disease, heart attacks, and strokes, for most people, they you know, that aren't doctors, they say cardiovascular disease would be just heart disease, but that's not, you know, that's not what the statistics when they refer to cardiovascular disease actually mean. And then on top of that, we have something called a mini stroke. Mini stroke is also, in medical terms, a transient ischemic accident. Is a TIA, or a transient ischemic attack, I'm sorry, is a TIA. And that differs from a stroke just in how long the symptoms last. So a TIA lasts from minutes up to 24 hours. So if symptoms resolve completely, you know, and what are the symptoms of a stroke? That, you know, can be facial weakness, it can be not inability to speak clearly, it can be loss of vision in either completely in one eye or loss of vision in part of the fields of the eye. It can be numbness or weakness, loss of sensation or weakness in our arms or legs. If those symptoms occur and then go away within 24 hours or less, that would be called a TIA, or transient ischemic attack. If the symptoms persisted after 24 hours, then that's a cerebral vascular accident or a stroke. And so any questions about that, Rylan? The definitions of stroke and ischemic brain disease?
Yeah, I think that makes a lot of sense. You know, I honestly didn't know what a TIA was, but the 24 hours makes a lot of sense. How do you know when a patient comes in if it's lasted for more than 24 hours?
Yeah, it's just by history, you know. So when did the symptoms start? And then how long? So you don't know while the symptoms are going if it's a TIA or a stroke. So it's guesswork, you know, and it's an important thing. Timing is critically important in neurology and in strokes, because we do have therapies that can be most effective if they are delivered within the first 3 hours of symptoms. And so for people that have a large deficit, meaning they have a lot of effect of that stroke, if they are seen in the emergency room and can be evaluated and giving clot busting drugs within 3 hours, that's a timing that's most effective. It can extend a little bit beyond that. It depends on the situation and the neurologist making the decision. I would say these clot busting drugs are not, you know, cures. They can help, but they also have risks to them, as you can imagine. They can increase the risk of bleeding, but timing is really important. And when we don't know the timing, then they don't use those blood clot busting drugs. So for example, if somebody wakes up with symptoms of a stroke, then they probably are not going to be eligible to get the blood clot busting medications, because we don't know when it started. So we have to know the exact timing of when that started to consider that therapy. So really good question. So we talked about stroke, really common, something we don't want. Nobody's volunteering for this. Who's at risk of stroke? What kind of people are the ones that need to be worried about that? Well, as I mentioned already, the risk factors are very common to those for heart disease. So people at the highest risk for stroke are those who are at an older age. So the older you get, the higher the risk. High blood pressure is a major risk factor for stroke. Smoking, diabetes, and being obese are all major risk factors for stroke. One particular risk factor that is not such a high risk factor for heart attack, but is a really strong risk factor for stroke is atrial fibrillation. So atrial fibrillation, most common heart rhythm problem cardiologists see, it is increasing at epidemic levels. It's when the top chambers of the heart, instead of beating in a coordinated fashion, there's electrical signals are running around chaotically in the top chambers of the heart, and they are just quivering instead of contracting in normal, what we call normal sinus rhythm. And the reason that atrial fibrillation, at least part of the reason why it increases the risk of stroke, is that blood can become stagnant in the crevices of the heart. One particular pouch called the left atrial appendage is a common area where blood clots can form. Those can break off and go to the brain and cause stroke. And so that's why people with atrial fibrillation have a 5 times higher risk for stroke than those people who don't have atrial fibrillation. That's 500%. But blood thinners can be remarkably effective in lowering that risk. So in people who are at high risk for stroke and have atrial fibrillation, very common doctors will recommend blood thinner medications. And I would encourage anybody who has atrial fibrillation to have a very thoughtful discussion with their physician, because especially strokes, not something you want, but the strokes from atrial fibrillation tend to be larger strokes, meaning more devastating with bigger problems subsequently, and can be preventable. So something to really know about and pay attention to. So so those are the people that are at highest risk for stroke. I think, like other things, family history, if you have a family history of stroke, then that's something that I would be aware of as well. So what are the treatments for stroke? And the stroke treatment has come a long ways in the last several years. That I mentioned earlier, we have clot busting drugs that can help in the acute setting. So generally within the first 3 hours after symptoms, they can help. Blood thinners in atrial fibrillation can help prevent stroke. And then interestingly, cholesterol drugs, in particular statin medications, have been shown to help prevent strokes. And that's kind of interesting because cholesterol, as I mentioned on the risk factors for heart disease and stroke, are very similar. Interestingly, high cholesterol is not necessarily a risk factor for stroke, yet cholesterol medications lower the risk of stroke. So that's one of the extra benefits that you get with statin medications potentially is a lower risk of stroke. So any questions about that, Rylan? Any thoughts?
That all makes a lot of sense. I guess the next question would be, how can we, even though that these effective treatments are around, how can we even further cut that risk and maybe not let that 70% happen, that 70% increase happen?
Yeah, so you led me right into exactly what we want to talk about today. So, preventing stroke. If this is something that you're concerned about, then it's important to know that you have a lot of power, a lot of impact that you can have on your risk for stroke in relatively simple terms and in simple ways. And so I just want to talk about a couple of research studies that showed a dramatic lowering of stroke risk in people who made relatively simple simple lifestyle choices. So the first study I'm going to talk about had over 36,000 adults. They followed these people for 14 years. So that's a really long study in healthcare. And what they found is that people who followed just 5 healthy lifestyle choices had a 67% reduction in stroke. So you can put this in perspective. If the group that made none of these healthy choices, they had 100 strokes, let's say, in their group, the same number of people in the group that made these healthy choices, there would only be 33 strokes. So what are those healthy choices? These are the ones that we all want to make if we want to lower our risk of stroke to the lowest possible level. Those are, number one, not smoking. Number two, maintaining a normal weight. Number three, being physically active. That's meeting minimum requirements or recommendations for physical activity, which is 150 minutes of moderate activity a week or 75 minutes of vigorous activity a week. Number four, eating a nutritious diet. And number five, not overindulging in alcohol. So, moderate alcohol in these studies was generally 1 drink a day for women, 2 drinks a day for men. Drinking excessively, we know, increases the risk of stroke. Another study, though, that showed these same 5 measures of healthy lifestyle lowered the risk of stroke even a little bit more, 72%. And so I think this is a foundation of starting with, if somebody says, I want to lower my risk of stroke, not starting with medications necessarily, but starting with these 5 factors can be remarkably effective in preventing strokes. All 5 of these are what we include in our Healthspan 10, the Healthspan 10 being the 10 factors that we have control over that have the most impact on our risk for heart disease, for stroke, for cancer, for dementia, for insulin resistance, for diabetes, for all the epidemics of chronic disease, for atrial fibrillation, as we've talked about, all of these factors being remarkably effective. So any surprises there to you, Rylan? Any thoughts?
Yeah, no, I mean, I think it's just the numbers again are striking. And again, it's fairly simple things that everyone knows. Like, if you ask someone, is smoking good for you, they're not going to say yes. Even if they do smoke, there's not really a way to rationalize that anymore. Yet it's still a big deal and it still happens. And, we're still doing things that are increasing our risk, and that's why stroke is predicted to increase 70%. So thinking just, they're obvious things, but it's important to not gloss over them because we hear it so much. I think we don't take it into account and think about it in our personal life of how we can make this better. And that's what we want to communicate. These are simple things, but it's the simple things that get overlooked and why we're facing these epidemics. So that's all I just wanted to point out. I also wanted to let everyone know, reach out to me if you want, and more information on the Healthspan 10. We have tons of resources. So let me know if that's something that I can provide you with.
Absolutely. It has become the biggest problem in healthcare, in my opinion. I mean, the world is incredibly unhealthy. It's just set up that way. We have so many, commercial interests that are making a ton of money by setting up pathways that lead us down choices that aren't good for us. And I know there are people out there, and I understand their point when they say, oh, well, it's personal choice. You have the choice to do the right thing. But I think that might be a little harsh in my opinion. Frankly, I know all these things really well. I know a ton of doctors, as you can imagine, in my life, and I know a lot of them that don't make great healthy choices all the time. I know how hard it can be when the environment, when the psychology of things are set up to trigger our behaviors in ways. I don't know. I don't want to say that we don't have control over those things, because we have to take responsibility. And ultimately we face the consequences, right? You make good choices, then you likely get good consequences. You make not good choices, and you're likely going to face, not so great consequences. No getting away from that. But I think acknowledging that this is really challenging in today's world to make that healthy choice I think it's important to recognize that, and to also be a little forgiving for ourselves as well, and have a little compassion and empathy for ourselves as well as others. The world is also put, there's a lot of there's a lot of misinformation, and so I think it's not very challenging to come up with rationalizations of why you made this choice or that choice. Oh, that probably wasn't, I don't drink as much as a lot of people do, so it can't be that bad for me. Or I watching that seventh Netflix show, in a row,
Yeah.
like these or spending hours on social media, like these things are just designed to keep us on their platforms, engaged on their things, even when they're not the best things for us. And another good example about that is processed foods, highly processed foods, right? Like I believe that's the biggest driver of our obesity epidemic. There's lots of them, there's lots of factors. I believe that's number one. And it's tough because that food is really convenient. It's really inexpensive. It tastes really good until you don't get a taste for it anymore. Like I don't eat much processed food anymore, even though my diet used to be 100% processed food, basically. I lost the taste for it over time, but it's very attractive and a very real challenge to get away from that.
Yeah. I think the trap we get into is, like you mentioned, is like thinking it's not that bad and kind of shrugging your shoulders, like looking at these things right here that you mentioned. Don't smoke, normal weight, physically active, nutritious diet, don't overindulge in alcohol. Those are simple things. Everybody knows those things, but shrugging their shoulders and saying, oh, I'm not that bad, or I'm not as bad as so and so. And comparing yourself to the norm, because the norm is not good. Like the norm is not headed
Yeah.
in the right direction. And we compare ourselves and think we're not that bad, but really it's that constant progression that's keeping us, headed in the wrong direction. So, we do have to go against the flow a little bit. We have to be active in this process and pay more attention to the simple things. Another thing that the human mind likes to do, and I've been noticing this about myself, but when there's a problem, come up with a really complex solution for it, when usually it's just something very simple, like you need to just eat a little better, or you need to just drink more water, or just go for a walk, just simple things. And we try to come up with these elaborate long-term scientific solutions when it's all here for you. Just start doing the things that you already do pretty good, start doing them better.
Yeah, it's yeah. I often have to make this point to people because they know my background. They know I'm into prevention and wellness, and so they make this presumption that I'm perfect in my lifestyle choices and have always been perfect. And that's just the most comical thing to me because I have been perfectly imperfect. Like I have struggled with, I still struggle with making the choices that I want to make for my health. I'm flawed. I know most of us, I haven't met anybody yet that isn't flawed. If you're out there, then let me know. I'd love to hear about it. But I think that is an important part of, achieving your goals is working with people that have been there and done that. You and I have been there and done that. Like we're not interested in judging anybody. We're interested in guiding people, like saying, okay, well, here's the choices. Which one makes the most sense to you? And when people start to see a clear path, how often they can make the choices that are going to pay off in the long run for them. That's really what we're struggling with is, what choice am I going to make in the moment? Because oftentimes the default, the pleasurable choice right now has long-term negative consequences. How do we make the choice in the moment that is going to lead to our long-term goals? That's challenging without support. That's challenging without a plan, without a framework, without support, accountability. I mean, I've learned it. I had to learn. I needed help to do these things, and when we work with people and provide that, it's just so exciting when they come back and say, "I can't believe how easy it was."
Yeah. And part of that, you brought up another really great point, is part of that is ditching that, oh, I'm already doing those things, oh, it's already pretty good, and admitting to yourself, okay, where can I improve and where can I be better? And that's where the real change happens, is opening yourself up to that, and seeing that and saying, okay, this is something I need to do, no matter what, and finding that long-term solution, through guidance, or through whatever is going to keep you going, having that reason to keep going. But I love the way that you said that, because nobody's perfect, and we all have our shortcomings in these areas and have room for improvement, but you have to recognize that and be open to that, to move forward. So
yeah, if you want to live a long and vital life, like if you don't care, if you're looking to check out early and be sick and all those things, that's a choice, of course. But again, I like, we're not here to change anybody. We're here to help people who want to achieve a certain goal. And there's a saying of, I'm paraphrasing here, but if you want what most people don't have, you have to be willing to make choices that most won't make. And I think that applies in this. And it doesn't mean, sometimes the pushback we'll get is, well, I need to enjoy my life, or I'm not willing to, be miserable to live a long time. Who is? Like, I don't want that either. Like, what we're talking about is things that enhance the value of life, that enhance the moment of life. And oh, by the way, they lead to great things in the end, but they're just not natural choices for a lot of us. We have to, we have to get some guidance, some education, some frameworks, of a system. That's what we do, is help people build those systems so that they can go as fast as they want, or they can go as slow as they need. But we're just making that step-by-step progress to getting them to where they want to go. And we do that centered around the Healthspan 10. I'm just going to review the Healthspan 10 here, because we've been talking about preventing stroke. Here's our comprehensive approach to preventing stroke. It's normal blood pressure, normal blood sugar levels, healthy cholesterol levels, and a healthy body weight or body composition. So those first four of the Healthspan 10 are our objectives. These are what we want to accomplish. The next six are the tools we use to achieve those top four objectives. And that is healthy nutrition, regular physical activity, avoiding toxins like tobacco and excess alcohol. But increasingly, we're seeing toxins be time spent on social media, screen time, Netflix time, watching the news. For some people, can be really aggravating. Avoiding those toxins, restorative sleep, managing stress, and then lastly, staying connected socially, staying connected to your purpose, connecting to other things as well. Like, I was listening to a podcast the other day about the health benefits of forest bathing. Have you ever heard of forest bathing, Riley?
Yes.
Yeah. In Montana, that's what they got to do, right? Is that why you moved to Montana?
Yeah. I got the trees right in front of my window.
Yeah, so this is a Japanese concept, I guess, originally or originated in Japan, but it was the time spent in the forest and nature, and the health benefits that has. And I think that's something that I've always recognized in myself, but just never had a phrase or really said, okay, I need to make this a part of my life. But whenever I've had that opportunity to be in nature, I feel better. I have a sense of peace, a sense of awe, oftentimes. And I don't know, maybe it's the trees that are communicating with me. I'm not sure.
Absolutely. I
Yeah.
heard something like, I can't remember the exact numbers, but it was like a what do you call it? Like as an observational study where people report like how they feel. Is that what that's called? Um, but it was like even if people have just put a plant on their desk, they reported like just like it was like something like 30 or 40% feeling more productive, more happy, just simple things like that. But we need to be connected with our roots and where we came from, and there's something about that that is peaceful to us, not having all this constant lights and stimulation and outside influences overloading us. We need that time to go bathe in nature, or just let things be simple for a
Yeah,
little
and
while.
I'll make a recommendation here if somebody's doubtful about the powers of trees, to read the book The Overstory. It's won the Pulitzer Prize. I don't know, if several years ago, but it's a book that is centered on multiple different stories about multiple different trees. So I know that sounds crazy. Like, why in the world would that be interesting? It is a fantastic book. As I mentioned, it did win the Pulitzer Prize for Best Fiction Book of the Year, and is a beautiful book and talks about the healing powers of trees as among
Well, I'll
many.
have to check it out.
Yeah, it's a great story. Okay, well, with that, we'll wrap up. This week's podcast is on preventing stroke. If you'd like any help, guidance, connect with us. HealthspanMD.com is our website. Our insurance-based practice is opening shortly. I don't know, we're hoping January, maybe February, depending on things outside of our control. But we are going to have a brick and mortar practice here in Phoenix that we are both incredibly excited about. And then join us next week. What now, or not next week? Is it 2 weeks, Rylan, that we're going to do?
Yeah, 2 weeks. Let me check because we have Thanksgiving next week, and then it will be December 8th.
That sounds like 2 weeks to me.
Yes, that's 3 weeks
3
actually.
weeks. Okay,
Yeah.
3 weeks. Okay. But the real point, lipoprotein little a, if you've not heard about it, you should. And if you have heard about it, you're probably wondering, oh my gosh, what am I supposed to do with this? Lipoprotein little a is, in my opinion, and I think this is shared by many people, the most important genetic factor in heart disease. And most people don't know about it. And in fact, a lot of physicians don't really know much about lipoprotein little a. But increasingly, people are understanding or recognizing or being told, oh, your lipoprotein little a level is up. And that is, because we're checking it. It's not usually part of a traditional cholesterol panel, but it's an easy enough thing to get. More people are getting it with advanced lipid testing, or they're getting genetic testing that's saying you have a genetic risk for an elevated lipoprotein little a. Next time we get together, we are going to talk about lipoprotein little a. What is it? What does it mean? And what can you do about it? So please join us in 3 weeks, and we'll talk about lipoprotein little a. Thank you again, Rylan. Always a pleasure. Thank you, everybody, for joining us, and we look forward to seeing you next time.
This information is for educational purposes only and is not medical advice. Don't make any decisions about your medical treatment without first talking to your doctor. Thanks for watching, and if you want to learn more about living a long, healthy life you love, click the link below to learn more about how we help people increase their health span. And if you like this video, hit the like button below, share it with your friends, and be sure to hit the bell and subscribe.